Hello, my name is Brandon Hayslatten and I'm the Senior Medical Advisor to the Lance Armstrong Foundation. I was asked to give an overview of some of the physical effects of cancer and cancer therapy on the opening of the LIVESTRONG Navigation Center. And what I'd like to do is convince all of us cancer survivors that establishing a LIVESTRONG care plan that outlines some of the physical effects and reasons to continue to have a relationship with a physician, either an oncologist or a primary care provider, can be really important. In particular, there are certain physical effects for which there is well-established screening recommendations and guidelines for early intervention to either prevent or treat some of the late physical effects. And I want to give just an example of these. Now, obviously, there's a huge range that depends on a patient's gender, a patient's age, the type of cancer, and most importantly, the type of treatment that they received. But let me give a few examples to convince you that a long-term care plan, such as the LIVESTRONG Survivor Care Plan, can be of use. So, for instance, cancer patients have an increased risk of secondary cancers, cancers unrelated to the primary cancer, things like skin cancers, or in women, young women particularly, who've had radiation to the breast, secondary breast cancer, or in patients who've had a lot of chemotherapy or radiation therapy, or even a bone marrow transplant, disorders of the bone marrow that can include anemias from chronic nutritional deficiencies, all the way to primary bone marrow conditions like myelodysplasia. All of these secondary cancers would benefit from early detection, and depending on a patient's exposures, there can be reasons to, for instance, start mammography earlier in women, or routinely check blood tests like a CBC looking for bone marrow dysfunction, or self or physician-directed skin exams, particularly in areas of radiation therapy, to look for secondary skin cancers. There are other organ systems that can be involved for which symptoms may be relatively mild, but screening can show abnormalities that can easily be treated. Some examples of this include the endocrine system. Both the gonadal system, so in males testosterone production and in females estrogen production, can be monitored and can be tested with blood tests, and in some instances a replacement with hormones is beneficial. But other organ systems of the endocrine system can also be affected. Glands like the thyroid gland, particularly in patients who've had radiation therapy, hypothyroidism can be easily detected in blood tests and easily treated with thyroid replacement therapy. Same thing with the adrenal gland and other endocrine systems. Patients who've had cancer and cancer therapy are at increased risk for cardiovascular and pulmonary complications as well. Simple screening for what's called the metabolic syndrome, cholesterol and glucose metabolism, early diabetes, can be part of a cancer survivor's routine care. And attention to symptoms like shortness of breath or palpitations can lead to early screening and treatment for cardiovascular or pulmonary complications that can happen from cancer therapy. Another potentially silent chronic physical condition associated with chemotherapy, steroids, or radiation is bone health. And depending on a patient's prior therapy, recommendations for bone density screening and intervention with calcium replacement and other therapies can help prevent bone problems and fractures in the future. And finally, what might be simple things like routine eye exams, particularly in patients who've had a lot of steroid or radiation exposure, to look for and treat early cataracts, or routine dental exam, because cancer patients have increased risk for periodontal disease and cavities. And finally, certain patients have risk for chronic immune dysfunction. For example, patients who've had a bone marrow transplant or patients who've had their spleen removed. And these patients can benefit from early prophylaxis, particularly around other medical procedures with antibiotics, as well as immunizations and repeat vaccinations. So I hope that laundry list of chronic physical conditions convinces you that cancer patients really do have a reason to create a LiveStrong care plan to look for some of these chronic physical effects and to continue a relationship with their medical providers. Thank you.